Thus, the fetus develops into a baby. And when it has fully developed into a baby, in about 9 months' time, the time to come out and live as a separate individual has arrived. And the mechanism by which the baby does it is called as labor. So, what is labor? Labor is the passage of the baby, which is the passenger, produced by the powers which push the baby through the passage into the world. So, the passage is a bony passage and a soft tissue passage. The bony passage, this is the false pelvis and this is the true pelvis. So the bony passage is supposed to be adequate if the distance between the two ischial tuberosities is equal to the 4 knuckles of the examiner's hand. Then the soft tissue passage consists of the uterus, the cervix, and the vagina. The uterus has got a cervix, and it has basically got 2 segments. The peritoneum is densely adherent to the upper segment but converts into a frock-like structure loosely connected to the lower segment. So that is the difference between the lower segment and the upper segment. Now, the uterine muscle is different. That means that a normal muscle will contract. This is the normal length of the muscle, L1. It will contract to L2. So this is during the contraction. But when it relaxes, its original length will be restored. So this will again become L1. So contraction, the length will reduce, and in relaxation, the length will be regained. But the uterine muscle has got a mechanism which is called as the ratchet mechanism, which ensures that the L1 length will contract, but even during the relaxation, the length that has been gained will be retained. So this will be L1, this will be L2, but this will stay L2. And this is because the fibers are intertwined, and what you call as a ratchet, there's a ratchet like this. So first it gets entangled here, then it gets entangled here. So that ratchet mechanism is responsible for this component of the contraction, which we call as retraction. So there's a hormone which is oxytocin secreted from the pituitary, and that starts the uterus going into this mechanism of contraction, relaxation, but retraction. So the normal contraction, normally uterus is contracting, but normally it is this type of contraction, and those are called as Braxton Hicks contraction. But here, this is the contraction of labor. So this retraction is added during labor under the influence of oxytocin. And what happens is that there is contraction. The blood vessels that pass through this contraction become contracted. So as the frequency and duration of contraction increase, the uterus becomes ischemic during contraction, and there appears to be pain. So normally, if this is the duration of pain, then this will be the duration of contraction, which you can palpate. But if there is obstruction, that means contraction is failing to push the baby out, then the duration of pain may be more than the duration of contraction. And this is very important. That's what you have to observe. And this is indicative of obstructed labor. Now, so what happens is that gradually the volume in the upper segment goes on reducing, and this lower segment volume goes on increasing. So gradually the upper segment and the lower segment goes on merging, and the width of this cervix reduces. So this width of the cervix reduces, and this is called as taking up of the cervix. And then after the width is considerably reduced, then the cervix starts dilating. That means the distance of the ends of the cervix goes on increasing. This is called as dilatation, and this is called as taking up. And it goes on dilating till the cervix becomes absent or not palpable, and the vagina and the uterus merge. So the vaginal cavity and the uterine cavity become one. There is no cervix in between, no palpable cervix in between. Now this dilatation and taking up is added by an intact amniotic cavity. Because the entire contraction of the uterus, the pressure is transmitted, and this amniotic sac keeps on wedging between the cervix and dilating it. So this is the mechanism of the powers. The contraction, the retraction, the contraction, relaxation, but retraction phase of the uterine muscle. And that's what happens. And that's what happens to soft tissue. The bony passages stay almost the same. Now the third thing that we must study is how would the baby move? The baby will move in a particular manner so that its passage through the pelvis is facilitated. And that movement is called as mechanism of labor. So what is the first thing to happen? The first thing to happen is the descent. So normally you can ballot the head of the baby from side to side, but then there is the descent. And after the descent, we'll make the head larger here, because that's the occipito-brachmatic diameter that is getting fixed into the pelvis. And because of this fixation, there is a resistance force which has been created. Now, as there is resistance, since the occiput is nearer the atlanto-occipital joint where the flexion extension will occur. So flexion extension axis is nearer the occiput, and if these two forces F are F, then the moment of this extension force, this will be the flexion force. So moment of Fe over the axis would be Fe into the small d, and this will become lesser than this forward FF into that big D, and therefore this flexion force will win. This force will win, and the head will flex. Now, as the head flexes, the occipital portion of the head would strike the pelvic gutter. This will be the levator ani of both sides, and this levator ani is the lowest part of the pelvic diaphragm. The levator ani is anterior. So here is your pubic symphysis, and therefore what will happen, that if this occiput was here, left occipito anterior, this will rotate and become exactly anterior. So what will happen to the head? If the head was like this, now the head would become like this. There will be a rotation of the head. So the second movement after descent, flexion, the third movement is rotation. So that now the occiput is anterior. Then what happens is that this is the pubic symphysis, and up to this there is the pelvic brim, and here is the auricular process and the greater sciatic notch, the ischial spine, the ischial tuberosity. Now after the head is flexing up to this point, but then this occiput movement gets plugged by the pubic symphysis, and therefore around this axis the head starts extending. Now when the head comes here, it will be extended. It will be extended like this. So around this axis, the head will extend around the pubic symphysis, because the resistance of the pubic symphysis is far more than the resistance of the sacrum, because the sacrum is a cavity. So then this movement becomes extension. After the extension, the head will strike the perineum, the perineal membrane. And now when it strikes the perineal membrane, and there's a vagina which is coming out of this perineal membrane, it will, as it passes through, it will initially dilate the vagina as the head comes, and then the resistance of this perineum will push the head back, Every time the head will be pushed back, the resistance of this perineum will keep on pushing this head back. So it will come down and then it will go back. Every time there is a force or force of contraction, till the largest diameter of the head, occipitobregmatic diameter of the head, crosses the perineal membrane. So now as this comes the perineal membrane, this is the largest diameter of the head, and now this will not go back. This is called as crowning. And after that the head will deliver. Now what you find is that the head has delivered occipito-anterior, but the body is still in the position of occipito-anterior, left occipito-anterior. So this head will derotate to regain its position in relation to the body. So this is called as derotation. It will align the head to the body, which is still in the occipito-anterior position. Finally, the shoulders, the lower shoulder of the baby, that will be the lower shoulder, and that lower shoulder will go into the anterior part of the gutter of the levator ani. So there will be derotation will be combined with rotation as the shoulder aligns. Now in this, the right shoulder will align into the gutter, and therefore this slight derotation will be now converted into a complete rotation, so that the face is facing on the right side. So that is because of the shoulder alignment. So after the rotation, the shoulders will deliver, the lower shoulder will deliver, and the body will deliver by lateral flexion. The body will deliver, supposing these are the limbs and these are the upper limbs, and here is the pubic symphysis and here is the sacrum. So the body will now deliver by lateral flexion. After this, somebody will clean the mouth of the baby and the lungs will start functioning. So initially what was the situation? That the umbilical artery was pushing deoxygenated blood into the placenta, and the placenta was returning oxygenated blood back to the fetus. So here was the fetus. Now this is umbilical situation, umbilical support or placental circulation. Now what will happen? That the heart blood now is coming, deoxygenated blood will now be coming to the through the veins into the heart. So this will be the atrium, then it will go into the ventricle, then through the pulmonary arteries into the lungs, From the lung, oxygenated blood will return into the ventricle, go through the aorta into the body, get deoxygenated in the tissue and come back through the veins. So this normal circulation, which is pulmonary circulation or lung-based circulation, has to be established. And for that, connections between the atrium, the ventricle and the pulmonary artery and aorta will get stopped. So the atrial septal defect will close, the ventricular septal defect will close, and the ductus arteriosus, patent ductus arteriosus will close. So that now the circulation has become air-based or lung-based. And that's how you take the first breath. So this is what is happening with the fetus. And with the mother, the uterus has now contracted from this length. The length of the uterus is this much. And therefore the placenta, which was stuck to the hole of the uterus, will get off this whole uterus. This is lower surface area of the uterus, and this is called as the postage stamp effect. And as it gets off and is sent out, this is the third stage of labor. Then the muscles in the uterus, which were just now showing the ratchet mechanism, will contract so hard that the blood vessels passing through them will get obliterated and the bleeding will stop. So this contraction of the muscle is brought about sometimes by an injection, and that injection causes that contraction and the bleeding stops, and thus the newborn is now into the world breathing the air that you and I normally breathe by combination of power, passenger and passages. The bony passages, judged by the 4-knuckle rule, interistitial distance, the intertwining of the soft tissue passages, judged by the ratchet mechanism, conversion of the uterine contractions into a ratchet mechanism contraction, which starts changing the volume of the upper segment and the lower segment, and gradually the cervix takes up, that means merges into the lower segment, and then dilates till it is absolutely absent, and the uterus and the vagina become one passage. Then this decreasing volume, because of the ratchet mechanism, pushes the baby downwards. So the first movement of the baby is descent, and then with the descent, because of the atlanto-occipital joint being nearer the occiput, the resistance of the pelvis flexes the head. The lowest portion of the head now, which is the occiput, goes anterior, that is the rotation. And after the rotation, there is more resistance from the pubic symphysis, so the occiput stops and the face goes on descending across the anterior surface of the sacrum, that is extension. and this, after the extension, it keeps on pushing the perineum, and the vagina dilates during contraction, but it becomes the same size, and gradually this dilatation keeps on increasing till the largest occipito-pragmatic diameter of the head prevents the head from going back any further, and this is called as crowning, and finally the head is delivered. Now the head regains its position in relation to the body, which is still occipito-anterior. This is called as derotation, and then the right shoulder goes into the gutter from the right oblique position, so that the rotation completes and the face of the child is pointing towards the right thigh, and then by lateral flexion the body and the feet are delivered. Then immediately the child respiration becomes from the umbilical to the pulmonary by closure of the patent ductus arteriosus, atrial septal defect, and ventricular septal defects. So the heart is now no longer being acting only as a pump. Now it starts pumping blood into the lung, and the lungs, air comes into the lung, and there is pulmonary exchange of oxygen and carbon dioxide. Then the empty uterus contracts further, and the placenta, by the postage stamp effect, is released and taken off, and the muscles are contract by an injection called ergotamine, so that the bleeding stops. So this was the way that the products of conception, the fetus, now comes into the world as a new individual.